I work with people that have autoimmunity, and I help them to identify drivers and triggers of the process so that they can hopefully dampen the autoimmunity and improve their symptoms and prevent progression of the autoimmune disease. And since COVID, I've noticed more and more people that are coming into the clinic that are telling me that all these problems developed after they were infected with COVID-19. Some people report issues after vaccination, and it's important to understand that there is scientific literature that supports the idea that the SARS-CoV-2 virus and the spike proteins are immunological triggers for autoimmune diseases. Now, there was a paper published in 2021 in Frontiers of Immunology, and the title of the paper is Reaction of Human Monoclonal Antibodies to SARS-CoV-2 Proteins with Tissue Antigens, Implications for Autoimmune Diseases. And what they identified, they took antibodies against different parts of the SARS-CoV-2 virus, and they took these antibodies, which are basically tags that stick to proteins and mark proteins for destruction by immune cells. Antibodies allow the immune system to tag things that are foreign so that other immune cells can more efficiently identify them and destroy them and clear them from the body. And viruses have been known for a long time to be triggers and drivers of autoimmune disease. The SARS-CoV-2 virus is a new virus, and the autoimmunity and the diseases that it may lead to aren't as well known or understood. However, this research paper, they were trying to determine through this process called cross-reactivity. Basically, it's where these antibodies made against different components of the SARS-CoV-2 virus, where these antibodies that the immune system would make when exposed, how they may be able to bind to other tissues in your body. And they checked to see, when they mixed these purified proteins with different purified tissue antigens or purified tissues, what tissues did the antibodies bind to? So this is called cross-reactivity. So an antibody made against the SARS-CoV-2 virus, different components of it, if it can bind to other tissues or to other proteins, then that is called cross-reactivity, meaning it can bind to both things. Even though it wasn't necessarily, the antibody wasn't produced to bind to the human tissue, it was produced to bind to the SARS-CoV-2 virus, it may be able to bind to human tissues, mistakenly through this process called cross-reactivity. And this occurs because of another concept called molecular mimicry, where the human tissue proteins are very similar to the virus proteins. And because of that, the antibody binds to the human tissue because it can't differentiate it from the virus. So they checked 55 different human tissues, and what they identified was that the antibodies had reactions with 28 of the 55 different tissues. What this means is that these antibodies against the virus and different parts of the virus, they looked at antibodies against 4 different parts of the virus. They looked at antibodies against the spike protein, antibodies against the nucleoprotein, antibodies against the envelope protein, and the membrane protein. So different components of the virus. So these are different antibodies. And then they mix these antibodies with these 55 different tissues to see if the antibodies would bind to any of the tissues, which may lead to the immune system reacting to those human tissues. So potentially initiating autoimmunity against those tissues. And they found very diverse immune reactions against the tissues. These groups of tissues included barrier system proteins. So like the intestinal barrier, there's this concept in functional medicine and functional immunology called leaky gut or intestinal permeability, where the intestinal lining breaks down and lets things from inside the gut move into the bloodstream, which can trigger significant inflammatory responses and potentially lead to autoimmune disease through a similar mechanism called cross-reactivity and molecular mimicry. But they found these antibodies would bind to barrier proteins including the blood-brain barrier, by the way, not just the intestinal barrier. They checked SB100 is a protein that is associated with the blood-brain barrier. They found that the antibodies, some of them would bind there, potentially triggering an immune reaction against the blood-brain barrier. Gastrointestinal lining, also they identified that these antibodies would bind to tissue transglutaminase 2, which is the target antibody. That antibodies are detected in celiac disease. So it may be something that activates, true gastrointestinal autoimmune disease. Thyroid autoimmunity. As I said, I work primarily with Hashimoto's thyroiditis. It's the most common autoimmune disease in the world, and it leads to hypothyroidism, to low thyroid. And I have had so many people come in and say, since 2020 or after, they had an onset of various problems, but definitely there appear to be more cases of thyroid autoimmune disease, but also neurological tissues, so brain tissues, different parts of the nerve cells, and even more. And I created and wrote down a list here so that I could give you, just a real quick rundown of some of the autoimmune diseases that, if the antibodies that bound to these different tissue proteins, if it did trigger an autoimmune disease, what would the name of the autoimmune disease be? Okay, so there's a list here, and I have 18 listed from the 28, because some of the tissues would contribute to the same autoimmune disease. Okay, so primary biliary cirrhosis, so that affects the biliary tree that connects the gallbladder and the liver to the small intestine. Scleroderma, a connective tissue disease. Systemic lupus, so SLE, erythematosus, if I can get it out, which is a major problem. It's a systemic autoimmune disease. It affects the nucleus of the cell. Mixed connective tissue disease, multiple sclerosis, rheumatoid arthritis, autoimmune myocarditis, so autoimmunity against the myocardial tissue, the heart. Hashimoto's thyroiditis, Graves' disease, autoimmune hepatitis, type 1 diabetes, stiff person syndrome, antiphospholipid syndrome, gluten ataxia. That's through the reactivity to tissue transglutaminase 6. That is an autoimmune disease against an enzyme in the cerebellum, the back part of the brain, and it can lead to ataxia, difficulty walking, speech, difficulty focusing. Dermatitis herpetiformis. Now, so dermatitis herpetiformis is associated with tissue transglutaminase 3. So it's an enzyme that's found in the skin. So it's literally like skin autoimmunity. It's also associated with like gluten immune reactivity. Celiac disease, tissue transglutaminase 2 is the target enzyme there. Neuromyelitis optica. So it affects the optic nerve that goes to the eye. And there are other tissue proteins as well that were identified. But this is a major problem, and no one really knows about this. A lot of the people that I've met and that have reached out for help, they suspected that maybe it had something to do with the COVID virus or potentially with spike proteins, but they're not sure. And there's no way for us to, for sure, track that and determine what the actual trigger of the autoimmune disease is. But we're definitely I'm seeing a significant increase in autoimmune disease, or at least it appears that way. And I wanted to make sure that everyone was aware of this, because if you've noticed some significant changes after COVID, it may be linked to autoimmunity. And so most of the people, I've had people reach out to me that had thought they had long COVID. And, long COVID is something that we don't yet have good biomarkers for. There are a few things that I think are promising biomarkers. Looking at systemic levels of inflammation like C-reactive protein, I think may be helpful. Looking at a 24-hour cortisol rhythm to see how your body produces cortisol over a 24-hour period. You use like a salivary panel typically to assess that, and there seems to be some literature suggesting that there may be disruption of the circadian or daily rhythm of cortisol production. Higher systemic inflammatory levels again, but there are no great biomarkers yet that can be used to say, yes, this is, long COVID. So right now, that's primarily a diagnosis of symptoms. But I have this strong suspicion that many cases of long COVID are actually autoimmune disease, and it's just undiagnosed. And the reality of autoimmune diseases are that they're not diagnosed until the autoimmune disease is so extensive and has done so much destruction that it's obvious that the tissues are being destroyed by the immune system. And that can be 5 years, 10 years, 20 years after the initiation of the autoimmune disease. What I think is most appropriate is that people get a screening test, like a multiple tissue antibody panel. I use a laboratory called Cyrex Laboratories for a lot of my immunological workups, where I'm trying to identify what the immune system is doing, what it's reacting to, because the model that I use is a functional immunological approach to autoimmune disease. So basically, we're looking at autoimmune disease through a lens of the environmentally induced model of autoimmunity. And basically, that model of autoimmunity says that there are environmental triggers that activate the autoimmune process. And there are some key components that break down that lead to making this more a greater likelihood of autoimmunity being initiated. And so when the barrier systems of the body break down, like the intestinal lining, the blood-brain barrier, the lung barrier, anywhere you have a mucous membrane, up in the nasopharynx and the sinuses, when that breaks down, it lets things into the bloodstream that could trigger an immune response, and the autoimmunity could be initiated that way through various immune mechanisms. Now, I don't want to get too deep in the weeds here, but molecular mimicry and cross reactions, which we're talking about, that's one mechanism. There are many others, though, where chemicals can initiate the autoimmune process. Food proteins, partially digested, or large macromolecules that make their way into the bloodstream, could trigger it through molecular mimicry. Pathogens are well known to be triggers of autoimmunity through the bystander effect, through cryptic antigens. There are many different immunological mechanisms through which autoimmunity could be initiated. Okay, that's an important thing to understand here. But I think that a lot of people that have long COVID, or that think they have long COVID, and the doctors don't know what's happening, I understand and I empathize with the doctors, but I think that one of the best things that they could do is to consider an autoimmune disease and start considering that in their differential diagnosis of what could be actually creating their symptoms, and ordering a test like a multiple tissue antibody panel. So I use Cyrex Labs. It's Cyrex Labs Array number 5. It screens for a number of the most common autoimmune diseases in humans, and it would help to someone that's dealing with unexplainable symptoms they suspect are related to COVID, that may help them to get a better idea of what's happening. And then if you have an autoimmune disease that's been triggered or initiated, then you can use that environmentally induced model of autoimmunity as a lens through which to start organizing and working up potential triggers, and looking at the barrier systems of the body, like the intestinal barrier, the blood-brain barrier, and using nutritional and supplementation strategies to help support that physiology, to try to help heal the barriers so you can regain better tolerance to your own tissues, dampening the autoimmune process, and if you're really fortunate, putting it into remission. But this is something I think is really important. I've seen so many people dealing with these issues. People have reached out on social media and poured their heart out about all these issues that they're having. And I think one of the main mechanisms here that we're seeing is that it is autoimmunity being induced by the SARS-CoV-2 antibodies that are reacting against the viral proteins. They're cross-reacting or binding to human tissues, causing the immune system to attack your tissues. It's autoimmune disease. That's what it is. It's where your immune system mistakenly attacks your tissues, and this is leading to a lot of the symptoms that they have. And the doctors aren't picking it up on their workup, because they might be looking at antibodies like anti-nuclear antibodies, or just a more non-specific workup, and you really need to go deeper. And the problem is, too, medically, at least most conventional laboratories, they don't have great autoimmune panels, and if they do, they're very, very expensive. The Cyrex Labs panel it's not covered by insurance, so that can be frustrating, but really, unfortunately, the model that we live in, the medical model in the United States anyway, it's it is what it is, but it doesn't cover a lot of things that may be helpful. And that's something that's, political. It has a lot of other challenges that I can't address here. But the Cyrix Labs Array 5 multiple tissue antibody panel, I think, is a great panel to help with people just screening to get a better idea of what's going on. It looks at neurological antibodies, gastrointestinal antibodies, thyroid antibodies, connective tissue antibodies, adrenal gland antibodies. It looks at so many different tissues. It's a great place to really start or to help you with figuring out what might be happening. If you have any questions, feel free to reach out to us. I'll do my best to help you. I do work with people around the country and in the clinic, so maybe I can help you out. But hopefully this information will help people to get a better understanding of what might be driving their symptoms. And that last thing I would say is it's important to also understand that the SARS-CoV-2 virus also created problems for potential vascular injury, right? So these microclots that occurred in people, they could create their own pathology, which is separate from the autoimmune process, and that is a different thing altogether. So a lot of the the long COVID symptoms may not just be from an autoimmune process. It could be also from these microclots and this vascular damage that may have occurred too, which again is a separate thing. But I think a lot of people, quite a large number of people, probably have antibodies to a lot of their own tissues that have been triggered by the virus. And one of the best things they could do is just to do a screening test to see if they have antibodies present, because the first stage of autoimmunity is silent. It's totally silent, where you just have antibodies in the blood, and there's really not significant symptoms and there's not significant tissue destruction. But as it progresses and moves to stage 2 autoimmunity, you have antibodies in the blood, plus you have symptoms. And then it moves to stage 3, you have antibodies in the blood, plus symptoms, plus significant tissue destruction. And in the conventional medical model, you don't get diagnosed with autoimmunity until it's absolutely clear that you have the tissue destruction. So in my opinion, that's too late. The antibodies against the tissues, so stage 1 is where you want to catch it. And then you want to start working it up and try to understand what is the immune system reacting to, what food proteins, what pathogens, what chemicals. You want to assess the barrier systems. Do they have intestinal permeability? Do they have a blood-brain barrier, leaky blood-brain barrier? Are they deficient in vitamins and minerals that are important for immune system regulatory function? So what's their vitamin D status? What's their essential fatty acid status? What's their antioxidant status? You have to look at and really compare, take a very large overview of their physiology, look at their lifestyle. How are they sleeping? Everything that you can consider, you need to consider. And that's really this functional immunological model that I'm talking about, that we use, is what I think is the best way to approach that. But, for some people, doing anything is better than nothing, right? So, intervening at any of those points. If your vitamin D is low, that might be something that could be helpful. If you're, essential fatty acids, you're not getting enough omega-3s, eating more fish or fish oils may be appropriate. If you're eating a whole foods diet rather than reducing processed foods, all those things may be helpful to some degree. But everyone has a unique fingerprint for the triggers that are driving their autoimmune process. So I wanted to share this information. I've seen it come up a lot more. I wanted to get this information out there, because it's it's so many people are just confused with what is happening and what could be happening. And I think this is a big piece of the puzzle. I think that a lot of people are struggling with this virally induced autoimmunity through this molecular mimicry and cross-reactivity, and it's just not being diagnosed. And quite frankly, once it is diagnosed, it's still what can be done about it? What can be done until many of these autoimmune diseases get to a severe or a more end stage? There's no medical treatment that's going to be prescribed. Typically anti-inflammatories, steroids, and immunosuppressants. And those are all reasonable things, but if you don't have to use those, then you don't want to use those because they all have very significant side effects. But there are people that, even I've worked with over the years, there are plenty of people that they have an autoimmune process that is so aggressive that no matter what we try, I'm not able to help them dampen the autoimmune process. And you definitely, like for example, if someone has autoimmune disease against their joints, they have rheumatoid arthritis, if you can't dampen that process, they need something to stop the autoimmunity so that they no longer have destruction of the joints, even if there are some consequences and side effects that they need to consider. Now, that's something that everyone would need to make individually with their doctor, but there is, I think, a time and a place for those things, because it's at least something to know that you have in the toolbox if trying to address the drivers and triggers of the process are not successful. But you could do them at the same time. You could do everything at the same time. So anyway, I hope this information is helpful. If you're interested in the paper is titled, let me see which one it is here. There are a few papers that have been published. Oh, I mentioned the title earlier. It's in the Frontiers of Immunology. I'll post a link to it in the video, but if you have any questions, please do post it. Let me know, and I'll do my best to help you out. Hope you have a good day. Thanks.